because sometimes we've had issues with audio, people like messing around and things and
Okay.
disrupting.
Okay.
So if I have to, I can unmute people, but great.
Okay.
Okay. Thank you.
Welcome to our Caribbean and African Targeted Health Improvement Program, CAHN Health Hour. The Caribbean and African Health Network, CAHN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell and many more. We have not forgotten to include within our health hours the many societal, cultural, religious and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you and we want you to use the time to listen, learn, share your experiences and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@cahn.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CAHN is funded by the National Lottery Community Fund.
Hello, everyone. Good morning and welcome to another episode of the Caribbean African Health Network Saturday morning health discussion. And I have a very prolific medical personnel with me today, and we're discussing a very, very important topic, which I'm sure we've heard about on the news all over the place, and might even have had some heart tremors regarding this dreaded disease, the Mpox, monkeypox virus. And we're going to hear, about it, what it's all about, how to, how it's spread, how to prevent it, how to recognize it, and, anything that we need to know, especially as, it's something that has been topical in the news in recent times. I have with me Mr. Mohammed Kamara. He is a medical doctor. He is a Mr. because he has a surgical. He's a surgeon and he's also an emergency department consultant. Very experienced, originally from Sierra Leone. He's done his medical training in Russia and in the United Kingdom. And not only that, he's a founder of an initiative called Wellbody Better Path Gentry, which generally works towards promoting health. He's won numerous awards, and if you attend this CAHN Health Hour, you would know that he's a regular face. He's won awards with CAHN, he's won awards professionally. He's a very experienced, very prolific doctor, and we're so privileged to have him here with us today to shed more light on this topic. You're very welcome, Mr. Kamara. Lovely to have you.
Oh, wow. Thank you so much for that. I thought for a minute you were talking about my twin.
It's all you, sir. And I didn't even say, that was just the tip of the iceberg, but because of time, so we can actually have the meeting, I decided to stop.
Thank you so much. Right. Okay. So, thank everybody, and thank you for having me. I was asked to talk about this topic. As it were, it's a very important topic because we all are at risk, irrespective. Now, you see the picture, it's scary. And I think we need to be scared because we're all at risk, especially the likes of us who are in the the business of providing healthcare. So Mpox obviously is not, I'd say, an unknown entity because it's been in the news, recently, and in the past 2 years it has also. But I needed to tell you a bit about this illness. It's not just something that was discovered 2 years ago. No, the very first time it was discovered was from monkeys in Denmark, and these monkeys are called cynomolgus. You may not have heard them, but in 1958 this happened. And then for the first time in the history of mankind, in 1970, we then found it in human beings. And as you can see, the trajectory, as it were, it then moved on to the 90s. But before it went to that, you had WHO actively monitoring the outbreak in Congo. So that's why it was really prolific and very endemic, because of the fact that it was there, but people were mistaking chickenpox for Mpox. And you would see why as we go into this. So 2022, there was definitely a public health emergency internationally. That was in July. And when you had about 60,000 cases in 150 countries and over 3,000 cases in the UK in itself. And that was just in August, as it were. So, but there was a lot of stigma attached to it. And hence the reason why the initial name or the original name Mpox, monkeypox, was changed to Mpox, because monkey, obviously, a lot of people look at it and they frown upon it because it's derogatory, as it were, although it wasn't found on people of color or Black people. But then, of course, what we know is it's definitely is more prolific in men sleeping with fellow men. So if you heard the mnemonic or the acronym GBMSM, I repeat, GBMSM, this is where this is coming from. So the G is gay, the B is bisexual, and the MSM is men sleeping with men. So it doesn't mean it's exclusively in this group only. It's definitely, as I say, a risk for all, especially the likes of us who are in the business of providing healthcare, the pregnant ones, women in this group, the ones who are having therapy for cancer, the ones who've got cancer, the ones who've got immune deficiency, like HIV and things. So there's a lot of people, a lot of categories that are at risk. So, as I said already, Mpox, or monkeypox as it was known, is definitely found in viruses, and that was in 1958, like I said. There's two distinct clades. So if you were to classify them, you have clade 1 and clade 2. And they are also subdivided into clade 1A and 1B, and then 2A and 2B. So the outbreak that we know of, which was like 2 years ago, was definitely more, if you like, ascribed, or maybe probably because of the clade 2 strain. Now it's a threat to everybody, as I said. There wasn't any vaccines at the time. They used a smallpox vaccine, which was very rare because smallpox at the time we know is supposed to be extinct, but then there's been a return. And so the vaccines is what was used, and they're using it. They're using other supportive therapy like antivirals. You get to find out. But as I say, everybody's at risk, especially even the children when they're being born. So if the mother has got it, there is the possibility of passing it to the baby. which is that, vertical transmission, as it were. And then, of course, the treatment we know is supportive, but it's definitely worse with people who've got immune deficiency. So it's a DNA virus, double-stranded. That's what's causing the illness. The reservoirs, as we can see, are from monkeys, squirrels, the rats, and of course, other wild animals, as it were. The vector is not known as we speak, but there's a vehicle, and that is contact. So if someone has got the rash, and the rash has broken out, and you caring for them, and it's the discharge or the secretions are on the linen or the bed sheets or the towels or the cutlery they've used, you could probably contract that. Also, if they're sneezing and coughing, even singing and things like that, you probably can get that. Of course, we know about sexual intercourse. You'll find out as we go on. So from the time of exposure to the bug to the time of the first symptoms, you're looking at probably 5 to 21 days. This is why the public health announcement or maybe advice is that if you are exposed to it, then you need to be monitoring yourself for 3 weeks, similar to when COVID was around, as it were. You have to understand that you need to be isolating if you're actually prone to it, or maybe you are exposed to it. You need to be isolating, and you need to be keeping an eye for this for about, as I say, 21 days. As I said already, the treatment is tecovirimat, which is again antiviral, pseudofovir, which also is another antiviral. Now, the treatment, which is very interesting, is the same for both the adult population and the children or the childhood population, as it were. Vaccines we talked about already, and the rash, you'll find out how he actually develops and how he actually finishes, or maybe finally you get to see what happens to the virus, to the rash. I need to tell you about the fact that up to 10% fatality is what is ascribed to this illness. The other illnesses obviously are more lethal, but this one up to 10%. And as I say, up to 4-6 weeks, you would actually see these symptoms, as it were. So, as I said already, there's the outbreaks, and the first one in recent times, 2022, was due to clade 1, which happened in the refugee camps in Sudan, as it were, sadly, and problems are still ongoing, as it were. For the past few years, Sudan has not been a very good place to be in. Yeah, and the deaths in Congo, which is where it is mainly endemic, was due to clade 1 and clade 1b. As of this year, which was like July when we started hearing about this, the clade has also been reported in other countries. Now, you may have heard Sweden reported the first case in August, 15th of August this year. Burundi reported a large number of cases, as it were. And of course, we're worried about the exporting or importation, if you like, if that's the word. In Africa, just this year alone, we have more than 24,000 confirmed cases, including 600 deaths. And in Congo, there's about 19, almost 20,000 of the clade 1A and the clade 1B infections. In the UK, we know for certain that there's been 286 cases and counting. This side is probably just telling you where the infection rate is quite high and where it's low. And you can see West Africa is not exempt. We've got ours there, definitely. And although it's moderate and it's mainly due to clade 1 and 2, but in Congo, where it definitely is 1B and 1A. And it's really high in those places. But you can see for yourselves in the data provided there, you can see, I didn't even realize that America has got over 33,000, and of course, it's amazing how this is something that we didn't realize, but there you go. So you can see for yourselves where it's definitely navy blue, it's most prolific. And you can see North America, South America, of course, West Africa. Now, where there's white, does not mean they're not there. It just means that they have not probably diagnosed any yet. But as I said, as long as there's people going in and coming out and things going on, then clearly it's just a matter of time that this thing will definitely spread. However, we know about it now, so we know what to do, and we know how we can try and stall it, or make sure it doesn't spread further than it has already. You can see for yourselves, Democratic Republic of Congo, DRC, is 3,000, and I think it would have gone higher now, as you can see. In France, there's over 4,000, and I think we know why. And you can see in the UK, it's there already, as you can see. In the Americas, as I said, it's over 33,000. In Brazil, you can see over 11,000. So it just goes to show you that there's a lot of countries in the world that have actually reported these cases. Some are in single units, some are in double, some are in, triple or treble, if you like, units. You can see that. So it's not something that you would think is probably just in one country or in one region. So this again is just an overview. It's caused by this virus, as we say. And of course, there's an outbreak that we know, which was mainly ascribable, or if you like, because of 2B, clade 2B, and it continues as it were. So the outbreaks are growing, but this particular one this year is because of 1B, and that's obviously gone beyond Africa. The natural reservoir we talked about already. And as I said, this is what I wanted to show you. So clade 1 and clade 2, you can see where it is in Africa. So clade 1, obviously you can see the likes of West Africa, Liberia, Sierra Leone, Ivory Coast, Ghana, Nigeria, and of course clade 2, where it is endemic in central, clade 1, sorry, I beg your pardon, in where it is endemic in Central Africa. So Gabon, Republic of Congo, Central African Republic, and of course some of Cameroon, and of course DRC, where it's most prolific, as it were. For West Africa, it's clade 2, which is more than 99.9%. And for the other countries that we just talked about, it's 1.1 to 3%. But of course, up to 10% of people sometimes can die from this illness. It brings me nicely to the mode of transmission. As you can see, on the left, on the top there, you can see mothers, as well as lactating mothers, or pregnant mothers, as well as lactating mothers, and of course the neonate, the one that's just been born. They're all susceptible. They can contract it, whether during labor or after that. The ones who miscarry, or the ones who go actively and get abortions. Prematurity is also a risk factor, and of course stillbirth is also a risk factor. Now, if you look at it, we know about animal to human, transmission, which you can see. So the ones who are handling the infected animals, so people who like animals and they don't know they've got it, they're breeding them, they might be susceptible. Like, if you go to places where there's monkeys or dogs, and of course eating the meat. So people that like eating, this bush meat and things. If the animal is infected, then there is the distinct possibility of you contracting the illness. The difficulty here is you need at least 3 weeks. That's why it's dangerous. So if you have contracted it now, you might not be aware that you've got it until after 3 weeks, which is a long, long time. And in that time, you could probably pass it on. So if you get the rash breaking out between the first 5-6 days, perhaps you pay attention to it and you can take the necessary precaution. But if not, then clearly it might be a difficult one. So from humans to animals, we know, from mother to baby, and of course from animal to animal, as it were, we know. So, as I said already earlier on, there's the mode of transmission. Someone coughs, someone sneezes. It's airborne, droplets. And of course, if you have the lesions or the rash, which is broken up or broken down, you probably find out how the rash develops and how it progresses. I think you'll find out when you look at it in the slides to come. And of course, with the cutlery they use, if you actually use it, you could get that. Of course, the linen or the sheets that they've been on. And finally, on the bottom there, you can see sexual transmission. Now, it's interesting how they put man and woman, or male and female. But we know that the majority of the people who this illness is found in are men sleeping with men. That does not mean they're the only ones. Because if you're working in the healthcare industry and you're exposed to it, which definitely does happen, then of course you might not be a man sleeping with a fellow man, but you might be straight as you were, but then you were exposed to it, and you can definitely get it. Yeah. So, like I said already, if you look at that, the top, you see the animals, they have it circulating in the mist, and nobody knows anything about it until the human being interferes with that cycle. And then, of course, we get it, as it were. So, animal to animal, animal to human, contact with infected animals, and you have the horizontal transmission. And then, of course, you have the human to human. So you got social transmission, as we know, contact transmission, and then, of course, vertical transmission when mother is giving birth to a baby. Now, if you look at B, you would see that there's various organs that are involved or affected, if you like. It affects the brain, as it were, and it can give you symptoms of meningitis. And of course, if you don't find the bacterial aspect of it, then of course there is what we call viral meningitis. But in this case, it could be the covering of the brain, which is called encephalus. So encephalitis is the inflammation of that particular aspect of the brain, which can be similar to meningitis. And sometimes you can only get to see that when they've done an MRI and they've done blood tests, and then they will tell you whether that's the case or not. It can cause conjunctivitis if it affects the eye. It can cause stomatitis, as it's you have lesions in the mouth and in the throat, and that could happen. Laryngitis, it can cause pharyngitis, it can cause. You got the lymph nodes in the armpit and in the groin, which is got to do with the lymphatic system. That is the immune system of the body, the military of the body, the defense of the body, which obviously protects from infections. So they swell and they get painful, and that is just to help you to probably react a bit quicker to the infection. Now, it could affect the heart, it could affect the stomach, because we have these lymph nodes in those areas. But then the heart has got a covering, which is the pericardium, and you got the infection affecting it. So it's like this fluid collecting between the heart muscle and the cover, and it causes pericarditis, which is a problem because it can actually impact on the functionality of the heart. The myocardium itself can get infected, and so you get myocarditis, which again is a problem. And of course, the muscles ache, which is one of the first few symptoms you get. Achy muscles, like you would have a cold, muscle ache. They call myalgia, and then you have the joints, arthralgia. They can actually get painful as well. And of course, we talked about the rash, which you'll see much about when we go further down. And of course, the genital region, the nether region, lower down, you can get the lesions there, and they can actually present as if to say you have a sexually transmitted illness. This is why it's complex. It's similar to many, many illnesses, and so therefore the differential diagnosis can be challenging and can be a bit difficult, really. Yeah. So there you go. You just mentioned these. As I say, 1 to 21 days after exposure is what you expect to be the incubation period, and the symptoms can last 2 to 4 weeks, but it can be even longer. And believe it or not, there are people who can have this illness and not show anything, but as you can see, the lymph nodes, the low energy is another thing. People feel exhausted because probably they're not sleeping much. Sorry. And you can see the chills, the rigors you get, as they call them in medicine, back pain, muscle pain, and the lymph nodes. And of course, you've got a temperature, which is typical of a viral illness. So, incubation period, as we say, if you look at it at the bottom there, you could see up to 21 days, and the initial symptoms. So between the 5th day or 21st day, you get these things happening. Rash, starting from there, the swelling of the lymph nodes, the sore throat, the fever, headache, then progresses. As you can see, the rash gets worse. It gets spread all over the body, and then it affects the other organs that we talked about already. In the chest, it can cause pneumonia as well. And in the heart, we know myocarditis and pericarditis. Heart failure can cause irregular heartbeat. And of course, if it affects the fingers, it can cause paronychia. And of course, the skin, it can cause cellulitis. And so if you look at the end bit there, the top bit, it heals on its own between 4 to 6 weeks. But of course, if you have a weak immune system, it could probably last longer, and sometimes it can cause death. And we know that up to 10% of people with compromised immune systems can die. I like this slide. This is the slide of the talk, because it doesn't just tell you about how the rash looks like in the people of color, ourselves, black person, but it's also on a white person. And like you see, the first one, obviously, it's like it because it's slightly like a chocolate. So upper half is in the darker complexion or the darker skin, and this bit is in the lighter skin. So when you get the rash, it's like macules, they call it, which is like not raised, and then it gets to be raised. It becomes a papule. When it's flat, it's macule. When it's raised, it's macules. And then the next thing you realize, you have fluid going into it. Then it becomes a vesicle, as you can see. So that vesicle has got clear fluid, like people who have chickenpox, you would see that. That's how it forms. But then the bacteria finds its way into that, and then it becomes putrid. It becomes pussy, becomes pus, and then it is now called not a vesicle, but because it's pussy, it becomes a pustule. That's what they call it. So they vary in sizes, and the pustule will then break down, like in chickenpox, and gives you this ulcer, which you can see in the darker rays, as you can see it here, and the lighter rays, you can see it there. So that would last. It crosses off, and then that would last up to 4 weeks, sometimes 6 weeks, and then it heals. And you can see the scarring that you get there. So this is what you get as a scar, the lighter color, and this is the darker color. So again, this is just telling you about the myocardium, as you were. The heart, get it, myocarditis. In the throat is epiglottitis or laryngitis or pharyngitis. In the brain, encephalitis, meningitis. And of course, it can cause problems with the bowels. You can get an abscess, and that can burst, and that would cause what we call peritonitis, which is definitely a do or die situation. It's very, very dangerous. So, it's not just exclusively in one area. It can cause a lot of problems with the body, especially when the immune system is weak. So this is just a manifestation. It's just showing you what the rash looks like in different skin colors, if you like, complexions and things, areas, when it's worse, when it's not so bad, when it's healing. If you look at it, you see for yourselves. So this is a very good slide because it tells you, it gives you the trajectory. It gives you how it looks like when it becomes a macule to a papule to a vesicle and then to a pustule, which is what you see there, and the number of hours or days that could last for. And in the end, after 9 days, you can see what you get there at the bottom there. And then you can see that when it's healing, that's what it looks like. So this is what I've talked about already. The pustule, as you can see on the left, which is D, is full of pus. And when it breaks down, it gives you that, if you like, ulcer, which then begins to heal bottom up. And when it heals, then you can be left with the scar, as it were, which is similar to chickenpox. So this is why it's difficult to be able to distinguish between these, because there's a lot. You have sexually transmitted diseases like herpes, syphilis, gonorrhea, chickenpox, smallpox. All of those look very similar, and of course the Mpox as we look at it. So it's important to know that it poses a challenge. But if you suspect it, then you have to deal with it in the appropriate manner. You'll find out as we go. So as I said already, the symptoms can be subclinical, which means you have it, you don't know you have it, and obviously you're the one that is most infected because you can pass it to people without knowing you got it. Yeah. So children, pregnant women, immunocompromised people, people who are having cancer and HIV, these are all people who are susceptible, and they definitely, this can lead to fatality. So differential diagnosis, like I mentioned already, you could see monkeypox, variola, which is smallpox, and chickenpox, and the other ones that I named. Now, as you can see, those who are medics might know about this, but you can see that chickenpox is one of those that you need to probably be mindful of. In the adult, it's really, really bad. In children, it's not so bad because, the childhood illnesses and children get through it, they sail through it, and they don't have a problem. Measles is another one. That is definitely lethal, as it were. There's a high mortality rate, especially now that we know there were parents who, because of one individual, did not inoculate or vaccinate their children, the MMR. They decided not to give it because somebody attributed that to autism and blah, blah. And so we've been having, as we know, outbreaks of measles, and definitely parents and families have been really badly affected. Skin infections can be similar to Mpox, as it were. Scabies, believe it or not, can be similar to Mpox. Herpes, we talked about. Syphilis, we talked about. The other sexually transmitted illnesses which affect the genitals, the sexual organs, are all something to consider. And that is why most of the people who have got Mpox diagnosed, they get checked for other sexually transmitted illnesses, especially HIV. Yeah. Now, I wanted you to look at it, the bottom bit. You see it here. It tells you fatality in Mpox is 1 to 10%, like we said already. But in smallpox, it can be up to 50%, believe it or not. And then, of course, in chickenpox, it's very rare. But the vaccines, as we know, Mpox, using smallpox as well. Of course, the smallpox vaccine we use normally for smallpox, and chickenpox has got its own vaccines as well. Now, reservoirs, as you can see, we know chickenpox, we've got the rodents, small animals, but then smallpox we know is human to human, and of course chickenpox human as well. Transmission, you can see face-to-face contact, respiratory droplets. When you cough, you sneeze, you sting and all that, you close to someone. This is why we need PPEs, the glasses, the masks, and the aprons, and the gloves, if we're going to be doing that as healthcare individuals. Yeah. If you look at the chickenpox, it's got 5 major genotypes and 22 strains. And if you look at the Mpox, it just got 2 clades, and smallpox has got 4. So this helps you as a clinician, because a lot of people think that if you go and do what we call this test called PCR, polymerase chain reaction, yeah, to look out for the virus, which is a double-stranded DNA virus, you probably could be mistaken, because if you look for that, you might not get what you're looking for. So it absolutely has to be vital that you're looking for a specific one. This is why you're looking at the swabs taken from the areas in the mouth and in the back passage and all of that. And it has to be rigorous, really, really heavy-handed for you to get to the bottom of it. And once you get the swab, which you'll be sending, you're putting it in a special media, special transportation that is ready for it. It doesn't have to be delayed at all. It goes to it. You're taking 2 samples to help you to detect it. So if you're taking it, please don't test the blood, because if you test the blood, you might end up being, not being specific in terms of this particular PCR that you want. And of course, the antibody detection, i.e., somebody gets invaded by the bugs, which we call the antigen, and the body responds by providing what we call antibody. So when they look for this in the blood, what they look for is antigen-antibody complex. And because they have this family that they all come from, the viruses, if you're looking for that, you might not be able to distinguish, because they all belong to these orthopox viruses, as I've said already. So therefore, you need the specific one, which is PCR, which is what would help you. And as I said, HIV testing is definitely mandatory on somebody whom you're suspecting Mpox in. And as well as the children, the adults are included in this as well. So treatment, we talked about, there's nothing specific apart from the smallpox, if you like, vaccine. People are talking about the Mpox vaccine. But the Tembexa, which is an antiviral, and the tecovirimat is another one they use as well. But the goal of treating patients or people is definitely taking care of the rash, making sure it doesn't get superimposed infection, making sure it doesn't become a systemic illness, which obviously affects the whole body, caused because of the lesions. When they burst, they're very painful. So therefore, you need to be managing the pain adequately. And of course, you need to prevent the complication that could arise from the rash affecting any of the organs that we talked about already. it mainly is supportive treatment. So the care is supportive and in helping to manage the symptoms and avoiding any further complications. So there is a vaccine that can help prevent infection. So if you're vaccinating the people, you obviously the high risk population are the ones that you definitely need to focus on. So there is pre-exposure prophylaxis and there is post-exposure prophylaxis. But definitely, if you get pre-exposure, it helps you a lot better because the infection rate will be low and the mortality or the fatality will be less. It's as simple as that. So whenever there's an outbreak, you definitely have to focus on the PrEP, as they call it, pre-exposure prophylaxis. We are very much at risk, as you are, the health and care workers, people in the same household. Now, this is it. In the same household and in close proximity, definitely are at risk, including children. The ones who are elderly, as it were, our older population, definitely are very much at risk. People who do have multiple sex partners, the sex workers, we know, of any gender, and their clients are very, very much at risk. And of course, we know that men that are having relationships or sexual intercourse with men are very much at a high risk, as it were. Individuals, as I say, with HIV would definitely have themselves commenced on this antiretroviral therapy within 7 days of being diagnosed. So, the do's and the don'ts. So, when you do feel that you've been exposed or you're feeling the symptoms, even if you're not sure, or maybe you traveled from an area, as we actually highlighted earlier on, because like on just yesterday, we had a patient who came from Thailand. And we know Thailand is not one of the areas. However, it's a very, 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 very common and very, very popular tourist destination. And so obviously we treated her as if she's been exposed to it. So we looked at the rash that she had on the elbows and felt unwell. We definitely contacted the infectious diseases center, which is at North Manchester, and we communicated with the Public Health England, and they actually took the names, the details, and advised us what to do. So we took the bloods, took the swabs, and then we sent him home because he was well enough to be home, and obviously cautioned him and safety netted him to be actually mindful of what he does and isolate himself for up to 21 days. Now, after the 5th day, I'm telling you this, after the 5th day, so 4 days is definitely mandatory. By the 5th day, the symptoms would have been sort of manifesting themselves. You have seen the signs and symptoms. If they don't, then you can extend it to 21 days. But obviously, within that time, you would know whether you've been exposed to it or not. And if you have, then obviously you'd have to be reporting that, and that needs to be taken into consideration. So contact the healthcare worker or the healthcare provider. Definitely stay at home for your own benefit. If you have a ventilated area, by all means, please do open the window for ventilation, because there's nothing better than natural air to help you. Remember, there's nothing better than washing your hands with warm soapy water, and then you can then follow that with a hand sanitizer. You need to be doing that as well before you look after the sores or the wounds, and of course after you've done that, wear a mask and cover the lesions when other people are around you to help you with your illness. Keep the skin dry, and as I said, uncovered only when you're on your own. Avoid touching items and in shared spaces, and disinfect the areas frequently. There's been suggestions that you can use salt water to rinse the mouth, which probably might be helpful, but it definitely is painful because the sores in the mouth definitely would be painful. But if you can fathom that, that would help. It would aid the healing. The warm baths with baking soda and Epsom salt have been found to be beneficial to some people. Over-the-counter medication, paracetamol, ibuprofen, naproxen, these do help to control the pain. But one thing you mustn't do, please, is don't pop the blisters. Don't scratch the sores. I know they may be itchy, but if anything, you might need to take some antihistamine to help you with that. Because if you scratch them, you can then reinfect your body. It's like, you are causing yourself more infection and you're spreading the body to yourself. So that's why you mustn't do that. Don't shave the area, if at all, it affects the face, until the scabs would have healed and the new skin would have grown underneath. And then, of course, you can then shave it. So I wanted to tell you this. It's absolutely vital. It's no surprise that the name was changed from monkeypox to Mpox, because we are very, very prone to stigmatization, stigmatizing people, or the bunch of people or the group of people who we know are prone. It is wrong, it is unacceptable, and it's not, I wouldn't condone that from anybody. You know, even though as a medic I may be at higher risk, but discrimination leads to nothing but catastrophe, disaster. Because if you stigmatize people who've got the symptoms, they will hide. Yeah? And if they hide, what do you think happens? They secrete it, and so therefore it spreads, because they wouldn't tell the person who's next to them. So whoever is caring for them or whoever they're living with are more at risk. And then it spreads from one to the other. And then there's the outbreak, and then it gets exported or imported. And so there is endless problems with absolutely stigmatizing people who you know are at higher risk or who you know have got the symptoms. Yeah, because of that, they will prevent the individuals from adopting the healthy behaviors we're all seeking. What can we do? We educate ourselves on the facts and share them like we're doing now. We sensitize people. We use the correct language. We shy away from the negative language that can cause stigma. And by sharing the accurate information, we will definitely be able to educate people, sensitize them, alert them, and make them more aware. And in so doing, we can definitely narrow it down and probably be able to seal it and avoid it from being widespread. So this is a case I wanted you guys to look at. For the medics who are around, if you look at it, this is a 45-year-old patient who gave consent for us to actually show this. I'm pleased because there's a person of color. He was diagnosed with HIV, and we know that with HIV you have your viral load. That is what is a marker or is a gauge for the control of the virus, and his was 140. Now, those that know about the CD4 count know that the mark that is normal or maybe acceptable range is 200. So his was low, which means definitely he was more at risk. He came to us with this, and he's got this rash, and it was worsening with spread, but of course, the leg was swollen and painful. And we consulted the skin specialist, and I'm sure when you look at it, you would think this is Mpox, but it isn't. Now, what this is what we call Kaposi sarcoma. It's a Kaposi lesion which is associated with HIV. So you see how it can be misled. And that is why at the very beginning in the Republic of Congo, people were mistaking Mpox for chickenpox. And similar to this case, people thought this man has got Mpox, but in actual fact, he's definitely got Kaposi sarcoma. So when they come to us in the ED, in the emergency department, this is how we approach them. We got the action cards, as you can see. When they come in, if you report to the reception and you say you're actually feeling the symptoms, but you've just recently returned from an area that is of interest, then obviously you will then be taken through this. And then, of course, you could see that if you belong to this category of GB, MSM, like I said earlier, you definitely, or you've got a temperature more than 38 degrees, you got headaches, you got muscle ache, you got joint ache, and you go in and you got swelling in the groin or in the armpit. And by the way, you don't necessarily have to have all of this. You might just have one, but if you've come from that area, then clearly it is something we need to do in terms of trying to make sure we find out whether indeed you've got it or not. And that is why you would be investigated. You would then be taken through what we do in terms of approach. So we've got the PPEs, we come with the gown, the glove, the eye protection, the mask, and then of course we have an area where we put them on, we have an area where we take them off, and of course we wash their hands, and then we then sanitize it. But if you can see here, you can see that the consultant or senior doctor alerts the Health and Safety Agency of the UK, and then we speak to North Manchester, which is where the center is for infectious diseases, and we then talk to our microbiologist, local or maybe the ones at the MRI to ascertain the likelihood of infection. And then, of course, they'll give us the advice based on the history, and we'll then follow that. And the imported cases have got a service, like a telephone number, which you can see there, the 0844 number. So 0844 7788 990. And then, of course, if it's a night shift, then we'll actually consult over switchboard to the consultant microbiologist, and of course the infectious disease microbiologist consultant, who will then give us the appropriate advice. And then once this person is then dealt with, and they either go home or they go for admission to the specialist area, that room is now definitely subjected to isolation and a deep clean. People who have dealt with that would know what that is. And all the linen is bagged in a specific way and then put in the machine where it's not touched. It's like a washable bag, which is then switched at 90 degrees and until it finishes. So this is how we work with it, and this is how things actually are taken care of. There is information out there about how to deal with them. If you're in a plane, in a flight, and you're in one row behind, again, you are always advised, if you come and you begin to feel symptoms within 4 days, you're definitely advised to isolate, especially if you don't know where the passengers are. If you're 3 rows behind, then you don't necessarily have to do that. Children who in that area, again, would probably not be taken off school. But if they show symptoms within the 21 days, then obviously they would be taken off school. So I've said a lot, I've talked a lot, maybe information overload I'm worried about, but I'm happy to take questions to the best of my ability. Thank you for having me, and best wishes.
Thank you very much, Mr. Kamara. That was a really, really an in-depth discussion about the Mpox. I'm sure there's no one who's here who's in doubt about, or who's still in the dark about what the Mpox virus is all about. Thank you for the systematic way you went through it, talked about, the virus, the different clades, the symptoms, which I think would be of really great importance to both medics and lay people. I think it's really very scary that the incubation period is that long, like you said. And that means that we have to have, a high index of suspicion. And it's important to know about it. So that means that when one starts to feel a certain way, obviously not to scare one, but if you've been hearing about it, then you probably would maybe seek help a bit faster if you have any such fears. And obviously the risk factors are there. So all those who are, like we would say, immunocompromised, like you said, those cancers, pregnant people, who have maybe autoimmune diseases where their immunity is generally a bit lower, and they would know themselves actually because they would have been managed in hospital and maybe told about such things, like people who had to shield during COVID and things like that, apart from the GBMSM that we talked about. So it's just good for everyone in any of these categories to be, extra careful, extra vigilant, and of course health workers like myself and yourself and all the other health workers watching, just to, be extra careful, and know how to seek help ASAP. One or two comments, but I would like to ask something and just clarify, okay? Maybe it was my mistake, but when you were talking about the risk factors, you did mention abortions and stillbirths. Do you mean they are risk factors or they are complications?
The complication could be miscarriage.
Okay.
But there are risk factors as well, because
Oh, really?
of the fact that if the mother has got it and the baby is born prematurely, they're very more prone to getting that. If they
I
conducted
see.
the surgical, termination, again, there is the distinct possibility of passing it on. So it's there. And of course, when they're having the baby, there's also that, if you like, vertical transmission that is likely.
Okay.
Remember, because it's the 21 days incubation period, therein lies the danger. And if you haven't got the symptoms, you don't know you've got it. This is where things can really get a bit complex, as it were. But it's been known to cause miscarriage, and stillbirths can happen as well.
Okay. Okay, makes sense. And then it was a bit interesting. Thank you for the, case studies that you talked about. I think it also brought it home to us. You talked about, a man who came in and you diagnosed him and you spoke with, the relevant bodies and they advised you to send back home. Do you do any contact tracing in such situations? And may I ask why such a person was not isolated? Is it because it's not like COVID now where there were just too many people to isolate, so we had to start saying go back home. Is it not something that we think was serious enough to bring him out of, the population?
Well, I mean, he came in his own car. He went to Thailand, and
Okay.
we actually discussed this with the public health, as it were,
Yeah.
health and safety, agency, and of course the infectious diseases and the microbiologists. So what we did was in accordance with the
guidelines.
the guidance that we were given, and because it wasn't clear as to whether this man has got it or not, they took the address, the details, and the family and the rest of it. They would actually actively follow. But what we knew was that if at all within the 21-day period he developed any of the symptoms, then obviously they were then, as I say, reported by him to the agency. And then, of course, if he needed admission, because he was well, there was no need to admit them. And there was no need for us to isolate them in hospital. They could do that in their own home. And that's what the guidance is in Public Health England, if you like. You can isolate, just like you did with COVID. There's no question about that. But the most important segment of it is the first 4 or 5 days. After the 5th day, you would definitely either be developing the rash or feeling the symptoms of the pain in the muscles, pain in the joint, and all the symptoms. And then, of course, now that needs to be swabbed, that needs to be taken into account, and then, of course, the treatment. But if you are high risk, if you are high risk, you belong into that category of high risk, then clearly they probably would do the PrEP or they will do the PEP, as it were. So pre-exposure prophylaxis or the post-exposure prophylaxis. And that's the way they handle it.
Okay, that makes sense. You've clarified that he didn't have any symptoms and it was early days, so it was just still, a high index of suspicion at that time. Okay, thank you very much. That is enlightening. I have a comment that's been forwarded to me from YouTube, and it's someone. I'm sorry I didn't get the name that was sent to me. It says, "Thank you for this session. I'm so something is blocking my comment. I'm so sorry," or something like that, "to hear about further deaths due to Mpox. As death stats for HPV," which I believe he means human papillomavirus, "as death stats for HPV-related cancers are 3 times higher, especially in the United States. I am shocked that more is not done for HPV." That's his comment. Do you have anything to say about that? Any links with HPV and this?
I think I don't know. Well, the comment, it's a comment. He's entitled to that. But we're talking about in America alone. I think if they're in America, 33,000. All right. It's now whenever you see WHO stand up or sit up and say, "Hang on, I need to do something about it. I need to actually indicate to the world that this is becoming a bug or virus of interest, international interest," there's a problem.
Yeah.
HPV is a virus, I agree, but obviously the death rate or the fatality or mortality that is quoted is obviously in place. However, I am obviously getting distracted now, maybe, if you like, not in the realm of what I wanted to say. If you remember, there's a young lady now, there's a young lady who was one of these TV celebrities who died sadly on Mothering Sunday. A few years back. Yeah. She had HPV and developed cervical cancer. And sadly, it was in the advanced stages when it was found. But she became the face of HPV. And because of her, the uptake of the HPV vaccine was absolutely increased, similar to how the king with the prostate problem and all that got highlighted and people were then checking themselves a lot more. So HPV vaccine was increased. Yeah. And because of that, in a couple of years, the detection of the cervical cancer, or the CAHN3, if you like, reduced by 25%, which is completely different from an airborne illness. Yeah, which is spread from person to person. Whereas, and of course, to add to that, it wasn't only exclusively for the girls to get the vaccine, it was also extended to the boys as well. So that did help to bring it down. I agree that it definitely is a higher death rate and all that. But believe you me, the way I was trained, the airway is what will kill you first. And you as an ethicist, I think you know about this. So if you have an airborne illness and it affects the airway and the breathing, you will die a lot quicker than somebody who's got a cancer down below. Not that I'm trivializing it, but I want them to understand that there are two different things we're comparing here. An airborne illness and an illness that is actually maybe there, but you don't even know about it, and then would only surface when, of course, it was found incidentally or it's in its advanced stages. I don't think you can compare. But it's definitely important to highlight the importance of HPV. There's no question about that.
Absolutely. I think it was like also the argument when COVID came and people were like, oh, flu has killed more people over time than COVID. But COVID was working pretty quickly, so they had to, all the, public health just had to give it all it got because people were dying much quicker than from COVID then. So I think that also informs.
There's something we know about herd immunity, which wasn't there. We were not prepared
at that time.
As a community, as a world. We didn't expect that. So clearly, if this thing is wiping you out, in fact, I can tell you this, for Saudi Arabia to actually shut its borders to Hajj, which will generate hundreds of billions of pounds, it tells you what I'm talking about.
How serious it was.
If you think I'm joking, you go to the high streets and you see the number of shops that are closed, and it's like ghost towns in the centers where you shop. All of that because of COVID. So COVID was something of in fact, when it happened in 1955, there was also 5 million people that died. And of course, it was like 500 million people that got affected, and out of them, you have 5, so it's important to realize that the magnitude, the spread, it's always important. If you have an airborne illness, it spreads faster and quicker than something that is probably in the body, which grows slowly, and sometimes imagine an incidental finding. I think it's important to register that point.
Absolutely. Thank you very much. There's another question here. It says, considering that there is no visible sign, or there are no visible signs and potential ease of transmission from an infected person, and a more connected world with travel. I think the person is asking, there's no name here as well. I think it was sent by direct message to one of the CAHN officials. It says, no visible signs, potential ease of transmission from an infected person, and a more connected world with travel. What would you suggest as innovations for agile detection at the early stages? Or are there pilot schemes ongoing? So we're dealing with, the signs are not easily there from the start. It's easy to transmit. And now there's much more connection with travel, holidays. I was actually going to ask that. One has to be really extra careful with holidays now. What would you suggest as an innovation for agile detection? Or do you know of any pilot schemes ongoing?
Well, I mean, I say I'm not a microbiologist now.
Mr. Kamara, how are you changing the world on this particular issue?
It's simple. Be vigilant, and if you like, selfish. If I was to be traveling now, for starters, this is the season when airborne illnesses are definitely rampant, if you like. If you think that's not the case, visit the EDs and you see the children. The wheezers, the bronchiolitis, you name it, the asthmatics, you name it, they're all there. They, so therefore, because you're going to be traveling, be vigilant. Get your mask on. You don't know who's next to you, and if you see somebody who is symptomatic, then definitely keep an eye on how things are. Normally, as I say, the body is waterproof, as we know. That's a God-given right. It's waterproof until there's a breach. in that, that skin, and then it begins to be the source of an infection. So therefore, be vigilant. If you know you've been exposed, then obviously keep an eye out for up to 21 days. You can actually isolate like we did. It's as simple as that. If you're dealing with somebody like that, what you can do is, obviously, you have to be washing your hands as you were, using your PPE. You need to be preservative as you were. You need to be selfish. I.e., if I'm going to see somebody when I'm not sure if they have it, what do you think I'll do? I'll definitely protect myself. Yeah? So if they tell me you've come from an endemic zone, or you come from an interested area or area of interest, and you now, after 2, 3, 4 days, you begin to feel the symptoms, clearly, as you say, my radar goes up. Yeah, the alarm bell goes up, and so I have to be more careful. Similar to when you're traveling or what you do. But what we're doing now is most important, because we are alerting people. We are sensitizing the world, to the significance of this illness. And so therefore, people will have to take heed to actually be, like I highlighted, you need to be self-protected. And the only way you can do it is by being vigilant. Simple as that. What you've heard today, put into practice, and that would help you. You can't stop everybody. Even if you took the vaccine, remember, the vaccine is just preventative. It's not curative. And that's what people sometimes, don't understand. Because you've taken the vaccine or whatever you think is immune, no. Again, this happened with COVID. If you took the vaccine will prevent you from contracting the severest form of the illness that would actually mandate you being put into a ventilator, where there's a machine that breathes for you. Therefore, the vaccine is important because it spreads a lot faster without the vaccine than with the vaccine. So similar to this, if you know what you need to do, if you come from the area, and that's why stigmatization is not the best thing to happen in this world. Because if I know that I'm going to be stigmatized, what would I do? I would secrete it. I would actually hide. I wouldn't want anyone to know it. And then I would, be there on my own and be passing it on to people without knowing it. So we need to do away with that, keep away from that, but alert, sensitize, educate, and make sure people adhere to what we're saying. It's as simple as that.
Thank you very much. That is true. And obviously, if one wants to travel, it's just good to be in the loop of what's happening in the news so you know how to go. But nothing beats just simple personal hygiene measures. And these days, a very what they call that thing, it's an English word I'm looking for, but very low threshold, yes, for wearing a mask generally. I mean, since after COVID, I remember when COVID was ongoing and I kept wondering how we lived life the way we did. Even I, as an anesthetist, were so used to tubing patients without masks. And at some point we were wearing like the full, masks. And I was like, see how life has changed, but yes, we have to be absolutely careful. I have one more question here. It says, apologies if you have been through this. How widely available is the vaccine? Also says, assuming more Black people have been infected, do we know whether a good percentage of Black people have been involved in the vaccine trials? This is from someone called FB. Thank you very much.
I don't know about more Black people being infected. I don't know about that. I don't know whether if they have a statistics they can quote, I'll be happy to see that. I don't know about that. I know it's endemic in certain areas in Africa, but that does not mean it's exclusively, to Black people. I mean, in America, as it were, 33,000, which is the highest rate in one continent, obviously. Okay. I don't necessarily agree with that. Now, whether the Black people are taking part in the vaccine research and, I can't tell you that because I'm not involved in that research. I wouldn't know that. And obviously you would have confidentiality anyway to maintain that. But of course, we know they're working on this. There's no question. But because of the lack of preparedness, this is what I'm talking about. The next pandemic, and it's there. It's just a question of time. When it would happen, we don't know. But are we prepared for it? I keep asking the question. I doubt very much anybody would say we are prepared for it. So therefore, the smallpox vaccine is what they know has been effective, and that's what they've been using. Now, 2 years ago, it was difficult to actually pile up or amass the amount or the quantity that was required. But since then, obviously, they've actually manufactured a lot more. So it's a lot more readily available than it was 2 years ago. So if you are one that belongs to that category of the high risk people, then obviously you probably would need to speak to the appropriate individuals, if you like, or maybe healthcare facilities to help you to get that. But more importantly, if you are one of those people, then the PrEP would be something that would be important to actually embark upon. And I'm sure they'll be readily available for you. After that, the PEP, as it were, is another option, which is good as well. So it's there.
That's
but
the
then,
pre-exposure prophylaxis, you mean?
yeah, the PrEP and the PEP, they're there. And if you belong to that high risk category, then clearly you need to be making yourselves known and having these conversations with them. And I'm sure they will tailor make any kind of decision to fit you. It's not a one size fits all. It's how you go, and when you go there, when you tell them what risk you're exposed to, they will then tailor make it to fit your needs. And I think that works a lot better. Because, as I said, anonymity is a problem, and people worry about that, and that's why the uptake is very low. So, but if people are assured that what they say remains there, and they know they're doing it for their own best interest, I'm sure the uptake will increase and it'll be better for that.
Well, thank you very much for that. We have a few comments just saying thank you very much for a brilliant session and how much they have learned. We really appreciate you, Mr. Kamara, for your time, for taking us through this in a very intricate manner. And I'm sure we're all leaving much more better educated about this. I think my take home from this is, understand what's happening in the world generally, which is one of the reasons why we're here. Low threshold for, personal hygiene all the time. You come in, you wash your hands, you go to an unusual place, strange place, or, you're around people who are potentially infected by any airborne, thing. Just wear your masks. Healthcare professionals, and there are many. You don't have to be a doctor or a nurse. You could be a care home worker or whatever it is. Just, be very careful with your PPE. Be very conscientious with PPE generally. Those who are at risk, yourselves, because if you're registered with a GP at all, there would be communications on why you're at risk. Maybe people with autoimmune conditions, people being treated for cancers, and so on and so forth. So be a bit more conscientious as well with protecting yourselves in general, even before you hear there's anything happening. We've heard about the symptoms, how they can be, a bit non-specific, but if for any reason you feel that you've been exposed or you've gone to a place where, there's that possibility of Mpox or whatever, and you're feeling malaise, generalized weakness, anything that's just unusual, it's always good to just shout out and have a checkup. The other thing that Mr. Kamara said that I'm sure has made my African brothers and sisters sad, you talked about bushmeat being a risk factor. Oh my goodness. That's one of the joys.
I know.
Joys of African diets.
I know.
So I'll just say,
that's
if you travel home, please be very careful with what you eat. Because you might just want to take one whole bunch of, oh yes, I need to buy, be careful. Because you really don't know where these come from. I remember when I was younger, when we used to do a cross-country travel, they'd sell it by the wayside. So obviously you really don't know. So be careful with that, guys and folks. I just said I'd drop that there.
No, you done well. Thank you so much.
Thank you very, very much. I'll hand over to Ruth or Benedict now to round up. But it's been a lovely time. Thank you, Mr. Kamara. And thank you for everyone who's spent this time listening. Thank you for your questions, for your contributions. It's been an absolute pleasure. I'm Dr. Amanda Digwe, your host for today. God bless.
Thank you so much.
Thank you.
Thank you so much again, Dr. Kamara and Dr. Amanda, for a brilliantly informative and engaging session. I'm just going to share with us now what's happening over the next few days and weeks here on Chicago. I will just share screen. Hopefully you can see. One moment, sorry, I'm just having an issue with this thing. There we go. So, looking ahead to our next health hour session now. So, next week, Saturday, at 11 a.m., we will burnout, which is probably quite relevant to many of us. I think we don't always know how to set boundaries and make sure that we get the rest that we need. So we're going to be going through that with Ion, and looking forward to hearing from him. So we'd really love for you to join us next week at 11, and we'll be going through that until 12. You can put your questions directly to this doctor on the day. Is not my friend. I don't know why it's not moving to the slide. Just give me a moment. There we go. Okay, so I'm not sure if you're all aware, we have a style session Tuesday evening. It follows a similar format to our health hour on Saturday. So we have a session and we have expert dietitians and nutritionists. A topic that's relevant in lifestyle as Black, Caribbean and African people. So please do tune into that from 6:00 on a Tuesday evening. Zoom, Facebook, LinkedIn, YouTube, same as with our health. Really looking forward to from today. We're going to be meeting at the Hilton in Deansgate, Manchester, every year, and it's going to be taking place from 6 p.m. We'd love for you to join us. Tickets are still available, so please do head to portal.com/gala to get families do head to get tickets for that, and family you may last week on Wednesday. If you have an event that's coming in celebration of Black Month, to let us know about that if it's happening in Greater Manchester, and we want to share that with our community so that we can support you, so that we can up the community together. Please do head to the website that's there to submit your event to us. People joining us right now from the Gorton Parenthood Hub. So hello, if you're still watching Health Live from there. Every Saturday we have for our Parenthood Hub. So not just mothers and fathers that are maybe expecting or already have young children. Along the parents, so please do find out more about our Gorton Hub by the links that are mentioned there, or getting in touch with Scott by emailing scholastic@CAHN.org.uk. We have another event that we're looking forward to next Tuesday on the 8th of October. It's Day. In attending that and you're based in London or Greater, please do linked there to register directly, or you can maybe take a picture of the link, or even just scan the QR code that's available right there to head. Okay, that's all from us today. Thank you so much for joining us. I really hope to see you next week. Hope you have a blessed rest of your weekend. Bye-bye.
Welcome to our Caribbean and African Targeted Health Improvement Program, CAHN Health Hour. The Caribbean and African Health Network, CAHN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell and many more. We have not forgotten to include within our health hours the many societal, cultural, religious and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you and we want you to use the time to listen, learn, share your experiences and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@cahn.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CAHN is funded by the National Lottery Community Fund.